As you age, your oral health undergoes significant changes that are often misunderstood or overlooked. Many people assume that losing teeth, gum disease, or oral discomfort are inevitable parts of aging, but the truth is far more complex and nuanced. There are factors at play that most dentists may not emphasize or even be fully aware of, and understanding these can empower you to take control of your oral health well into your senior years. Aging does affect your mouth, but not necessarily in the way popular narratives suggest. The key lies in recognizing the underlying causes, proactive prevention, and adopting habits that promote long-term oral wellness. One of the most common misconceptions is that tooth loss is an unavoidable consequence of aging. While it's true that the risk increases with age, it's not an inevitability. Many older adults retain most of their natural teeth if they have maintained good oral hygiene, regular dental visits, and healthy lifestyle choices. The real culprits behind tooth loss are often preventable conditions like gum disease, periodontitis, decay, and neglect. These issues develop gradually over years and are compounded by factors such as smoking, poor diet, stress, medications that cause dry mouth, and systemic health issues like diabetes. Gum health is paramount when it comes to aging and oral health. Gum disease is a silent, progressive condition that can start with minor inflammation, but eventually lead to the destruction of the supporting structures of your teeth. It's often painless in its early stages, so you might not notice the warning signs unless you pay close attention. Symptoms, such as bleeding gums during brushing, persistent bad breath, receding gums, or loose teeth are signals you should not ignore. Left untreated, gum disease can accelerate bone loss in your jaw, making teeth more prone to shifting, loosening, or falling out. This process can also impact your facial structure, causing a sunken appearance and premature aging of your face. Many people don't realize that gum disease is linked to overall systemic health. Chronic inflammation in your mouth can increase the risk of cardiovascular disease, stroke, diabetes complications, and even cognitive decline. Conversely, managing gum health effectively can improve your overall well-being as you age. Regular professional cleanings, proper brushing and flossing, and addressing early signs of gum issues are essential. However, what many don't realize is that traditional brushing alone isn't always enough. Using an electric toothbrush, incorporating interdental cleaners, and maybe even considering antimicrobial rinses can make a difference. Furthermore, lifestyle modifications like quitting smoking and maintaining optimal blood sugar levels are critical for preventing gum disease progression. Another often overlooked aspect is the impact of dry mouth, or xerostomia, which becomes more common as you age. Dry mouth not only causes discomfort, but also significantly increases the risk of decay and gum disease because saliva plays a vital role in neutralizing acids, remineralizing enamel, and washing away food particles. Many medications prescribed for conditions like hypertension, depression, allergies, or arthritis list dry mouth as a side effect. Yet most people aren't aware of how damaging this can be to their oral health. To combat dry mouth, you can stay well hydrated, use saliva substitutes, and avoid substances that exacerbate dryness, like caffeine, alcohol, and tobacco. Tooth decay doesn't discriminate by age, but its patterns can change over time. As you age, enamel, the hard outer layer of your teeth, becomes more brittle and susceptible to wear. Additionally, receding gums expose the roots of your teeth, which are less protected and more prone to decay. Root cavities are a common problem among older adults, often developing unnoticed because they are in hard-to-see areas. Regular dental checkups, fluoride treatments, and remineralizing agents can help strengthen vulnerable areas. Yet, many seniors neglect these preventive measures, assuming decay is just part of aging or that it's inevitable. The role of diet in maintaining oral health cannot be overstated. As you age, your nutritional needs change, and deficiencies in vitamins and minerals can weaken your teeth. Vitamin C is essential for gum tissue repair and immune function, Insufficient intake can lead to bleeding gums and delayed healing. Ensuring a balanced diet rich in fresh fruits, vegetables, lean proteins, and dairy can significantly bolster your oral defenses. Conversely, frequent consumption of sugary or acidic foods and beverages accelerates decay and erosion. Many older adults indulge in soft drinks, fruit juices, or processed foods that are high in sugar, neglecting the cumulative damage they cause. Saliva's protective functions are often compromised with age, and this can lead to increased sensitivity and discomfort. Reduced saliva flow not only promotes decay, but also alters taste perception and makes speaking and swallowing more difficult. Chronic dry mouth can also lead to fissures and cracks in the tongue and lips, creating additional entry points for bacteria. Addressing this condition involves more than just hydration. It may require medical interventions or adjustments to medications under your healthcare provider's guidance. Medications can have profound effects on your oral health, often in ways that aren't immediately apparent. Beyond dry mouth, some drugs cause gum overgrowth, gingival hyperplasia, which traps plaque and fosters bacterial growth, exacerbating periodontal issues. Others may weaken your immune response, making it harder to fight off infections. It's critical to inform your dentist about all medications you are taking so they can tailor your treatment plan accordingly. Sometimes, switching medications or adjusting dosages can alleviate oral side effects. The aging process also impacts the structure and composition of your jawbone. Bone density naturally diminishes over time, a process accelerated in conditions like osteoporosis. This loss of bone support can contribute to tooth mobility and the eventual need for dentures or implants. Furthermore, jawbone deterioration affects the stability and retention of dental prostheses. Dental implants, properly placed and maintained, can stimulate bone growth and preserve facial structure, but they require diligent oral hygiene and regular checkups. Many seniors underestimate the importance of implant maintenance or believe that dentures are the only solution, overlooking the benefits of modern restorative options that can preserve natural bone and function. Your oral hygiene routine must adapt as you age. Manual dexterity often declines due to arthritis or neurological conditions, making it harder to brush and floss effectively. This can lead to plaque buildup, tartar formation, and an increased risk of decay and gum disease. Electric toothbrushes with larger handles or adaptive features can be invaluable tools in maintaining oral cleanliness. Flossing might become challenging, but alternative interdental cleaners like water flossers or interdental brushes can help remove plaque from tight spaces. Regular professional cleanings become even more critical, as plaque and tartar buildup can occur more rapidly and be harder to remove without professional assistance. In addition to traditional dental care, emerging technologies and therapies are transforming aging dentistry. Laser treatments for gum disease can reduce discomfort and promote faster healing. Remineralization therapies using bioactive materials help repair early decay without invasive procedures. Stem cell research offers hope for regenerating lost tissues in the future, and ongoing studies are exploring ways to reverse age-related damage at the cellular level. However, awareness of these advancements remains limited among the general public, and many older adults continue to rely solely on conventional approaches. Psychological factors also influence oral health in aging populations. Fear of dental visits, anxiety, or previous traumatic experiences can lead to neglect and avoidance. This avoidance results in worsening problems that become increasingly difficult to treat. Building a trusting relationship with your dental provider, understanding the importance of regular checkups, and addressing fears through sedation or counseling can help overcome these barriers. Remember, proactive care is your best defense against complex and costly dental issues later in life. The connection between systemic health and oral health becomes even more apparent as you age. Conditions such as diabetes, heart disease, osteoporosis, and rheumatoid arthritis not only affect your overall health, but also have direct implications for your mouth. For example, uncontrolled blood sugar levels can worsen gum disease, while periodontal infections can impair glycemic control. Managing these systemic conditions with your healthcare team is essential for maintaining optimal oral health. Conversely, maintaining good oral health can positively influence. Embrace a mindset that recognizes oral health as an integral part of your overall well-being, not just a cosmetic concern. By doing so, you can significantly enhance your quality of life, preserve your natural teeth longer, and age with confidence and health. In summary, aging and oral health are deeply interconnected, but many of the challenges faced are preventable or manageable with the right knowledge and habits. Recognizing that issues like gum disease, decay, dry mouth, bone loss, and systemic health are linked empowers you to take proactive steps. Regular dental checkups, proper hygiene, a balanced diet, lifestyle modifications, and staying informed about new treatments all contribute to maintaining a healthy, functional, and beautiful smile throughout your life. Don't accept the narrative that oral health must decline with age. Your actions today can shape a healthier, more vibrant tomorrow.